Today I would like to present the three main branches of dermatology. Dermatology is known as the study of skin, hair, and nails for both children and adults. The American Academy of Dermatology describes three branches of dermatology. These three branches include cosmetic dermatology, medical dermatology, and surgical dermatology. The cosmetic branch deals primarily with the aesthetic part of the skin. The medical branch focuses on diagnosing and treatment of skin, hair, and nail-related issues. The surgical branch focuses primarily on removal of malignant lesions. With cosmetic dermatology, the patient is looking for treatment out of vanity and not necessity. The dermatologist must be an expert in facial anatomy and become familiar with products and procedures to provide the best patient outcomes. The most common issue patients address the dermatologist with are wrinkles or rhytides to the layperson. A consultation is usually performed first to discuss options such as Botox, fillers, or laser treatments. The dermatologist may suggest Botox for rhytides in the glabella, forehead, and lateral canthus areas. Botox is a drug made from the bacterial Toxin botulinum. This drug is used to primarily paralyze facial muscles. This paralysis improves rhytides that are induced by movement. Botox is distributed in a vial as a powder form. The physician must understand how to properly dilute the drug, draw up the correct amount, which is different from patient to patient, and understand what muscles to target to get the correct reaction. Patients normally see improvement within 7 to 12 days. Some adverse reactions include brow ptosis, eyelid edema, eyelid ptosis, and headache. Fillers are another way to improve on fine lines and wrinkles. While there are many fillers on the market, the most commonly used ones in dermatology are hyaluronic acid fillers such as Restylane, Juvederm, and Perlane. While these fillers are not permanent, the patient will notice the results immediately. Results should last anywhere from 6 to 12 months depending on how much is used and the location it is used in. Common side effects include swelling, redness, bruising, tenderness, itching, and pain at the injection site. Another way a cosmetic dermatologist improves aesthetic appearance is with the use of lasers. The first lasers were introduced to treat port wine stains, a benign vascular birthmark. Now, with the help from a pulse dye laser and the different wavelengths it can reach, dermatologists can successfully treat any surface vascular lesion, such as angiomas, rosacea, erythema, and the port wine stain. Another laser is called the CO2 or carbon dioxide laser. This specific laser is used to treat a wide variety of conditions from aging skin, rhytides, and striae to scars, nevis, verruca, and rhinophyma. CO2 lasers work by penetrating through the epidermis and into the dermis. Tiny microscopic injuries are induced to stimulate new collagen. Although this is an outpatient procedure, the skin is raw and the patient will be susceptible to infection. Due to the intense treatment with the CO2 laser, the risk or side effects varies and ranges from mild cases such as acne, milia, and contact dermatitis to severe reactions like fibrosis, hypertrophic scarring, and ectropion. It is important for both the patient and the provider to ensure that all questions are answered and that the patient is comfortable in their choice. In medical dermatology, the physician is examining patients for any problems such as skin cancers or skin conditions. A dermatologist will typically examine the patient from head to toe. The dermatologist will have to inspect the patient carefully and will state their findings to the transcriptionist to enter the data into the patient's chart. The dermatologist will be able to tell the difference between a seborrheic keratosis, which is a benign lesion that can appear anywhere on the body, and a melanoma, which is a deadly skin cancer. According to Cancer Facts and Figures, 5% of all new skin cancers in the United States are melanoma. If cancer is suspected, the lesion will be biopsied for accurate diagnosis. This entails locally anesthetizing the area, using either a 15 blade or a Persona blade to scrape the top few layers of the skin to the dermis. Aluminum chloride or electric cautery will be used to establish hemostasis. Once the sample has been taken, it will be placed in a jar filled with formaldehyde, so the tissue could be preserved until it's processed at the lab. Once the results are rendered, the dermatologist will contact the patient to discuss treatment if necessary and schedule future appointments. Rashes are a very common issue in the dermatology field. Skin rashes looks can be either very specific or ambiguous in presentation. For example, psoriasis is a type of skin rash that is an autoimmune disease, while eczema or eczematous dermatitis is a skin condition without known cause. Both eczema and psoriasis can present in erythematous plaques with surface scale and sometimes blisters. Although they both require treatment with anti-inflammatory medication, it is imperative to know the exact diagnosis for correct treatment protocol. Eczema can be maintained with topical steroid creams such as hydrocortisone, triamcinolone, and clobetasol. Psoriasis can spread throughout the body, and treatment with ultraviolet UV phototherapy or biologics may need to be initiated. Ultraviolet therapy is a treatment using a fluorescent light that mimics UVA bands, matching the ultraviolet output from the sun. Biologics are a form of medication that is injected under the skin and regulates different inflammatory markers associated with psoriasis. Biologic therapy helps suppress the body's immune system to stop and reduce the symptoms of psoriasis. Actinic keratosis, AK, is another common diagnosis a medical dermatologist will treat daily. Actinic keratosis are precancerous lesions caused by chronic sun damage. Treatment for these lesions include liquid nitrogen, LN2, photodynamic therapy, PDT, and 5-fluorouracil, 5-FU. While LN2 and PDT are procedures done in the office, 5-FU is a topical chemotherapy medication that is prescribed. When applying 5-FU, the area with the AKs start to become erythematous and scaly. The medication focuses on the cells that are dividing rapidly, which are the precancerous cells, and cause cell apoptosis. This results in the reaction experienced when using the medication. Surgical dermatology involves surgically excising and repairing defects made from excision of cancerous or bothersome benign lesions. The three main types of skin cancers are basal cell carcinoma, BCC, squamous cell carcinoma, SCC, and malignant melanoma, MM. Basal cell carcinomas and squamous cell carcinomas are the most common of the three types of cancers. Over 4 million cases of basal cell carcinomas are diagnosed in the United States each year, while 1 million cases of squamous cell carcinomas are diagnosed each year. However, in the past decade, there has been a steady increase of reported melanomas. The American Cancer Society is estimating around 180,000 new cases of melanomas to be reported in the year 2018. There are two different ways a dermatologist can excise these cancers. The first is called an elliptical excision or wide surgical excision, WSE. A WSE is an excision that is performed in the shape of a football with margins reaching around 4 to 6 millimeters. After removing the cancer, the physician then cauterizes the blood vessels and proceeds to place sutures in the skin to close the wound. The piece of tissue will then be sent out for pathology to check the margins and make sure all the cancer is removed. The second way of removing a skin cancer is called Mohs surgery. Mohs was developed in the mid-1960s by Dr. Frederick E. Mohs. This technique developed over time to what it is known as today. Mohs is performed on mainly basal cell carcinomas and squamous cell carcinomas. The surgical dermatologist takes a very small margin around the cancer. The histotechnician is given the tissue to process while the patient waits. The dermatologist then checks the layers under the microscope to see if the margins are clear. If there are any positive margins, the doctor will know exactly where the cancerous cells are and will only take the section to process again. This step will repeat until all the margins are clear. This procedure is done to ensure the margins are kept as small as possible and to ensure the conservation of as much healthy tissue as possible. Dermatology is a medical field that offers many flexible opportunities for those interested. Cosmetic dermatology relates to treating people who are looking to improve aesthetic appearance. A medical dermatologist poses many investigational challenges for the provider. A medical dermatologist gets to spend a lot of time one-on-one with the patient and provides the important duty of identifying skin cancers. The surgical dermatologist then takes over and provides a treatment for the diagnosed skin cancers. Treatment is rendered, and the surgical dermatologist has played their role in saving another life. Dermatology, like many other medical professions, communicates in its own language. This specific terminology allows a dermatologic professional to communicate their findings to peers and translate to their patients to ensure understanding is achieved.